Hi, my name is Jamie. I'm going to be your nurse practitioner today. Thank you for coming in and congratulations on your pregnancy. I see here you just have some concerns about some symptoms that you're having and just about your pregnancy in general, and I just wanted to go over a few of those things with you. So I see that you're concerned that potentially the fact that you were on birth control may have contributed to this unplanned pregnancy, given that you were on oral contraceptive pills for birth control. However, I just wanted to let you know that studies show that there's really only one type of antibiotic that can really affect your birth control that much to allow for pregnancy, which is rifampin, which is used to treat tuberculosis. I'm sorry to say that I doubt that the pregnancy was caused by you using antibiotics while on your birth control. However, oral birth control pills have a lot of variability in efficacy due to and how effective they are, because there's so much that you have to be responsible for in terms of taking it every day, taking it at the same time every day, and that can be really hard for some people or for anyone in general. Even if you miss it by an hour or two, it has been proven that it is less effective when not taken at the same time every single day. So, there's no way to say exactly how your pregnancy happened, but I'm really glad that you're embracing it and taking the initiative to get seen, giving some of these symptoms that you're having. So, again, I'm really happy that you came in to see me to address some of your concerns. And if you are interested in a different type of birth control that maybe has less variability in how effective it is, we can always talk about that after you have your baby, but just know that there's no birth control that's 100% effective at preventing pregnancy, with the exception of sterilization, meaning that you get your tubes tied, or what we call a tubal ligation, or your partner gets a vasectomy. So those are really the only two ways that are guaranteed to prevent pregnancy 100%. So I see that you went to Rio de Janeiro, which is really exciting to see the Olympics. I bet that was a super fun time. But while you were there, you were pregnant and you're concerned that you might have been exposed to Zika virus. So I just want to talk to you a little bit about that. So yes, Rio de Janeiro and Brazil particularly is one of the areas that is affected by Zika virus at this time. So you or your partner could have been exposed to Zika virus while you were there if you received any mosquito bites, because the Zika virus is mainly carried by mosquitoes. So if we see that you came home and were covered in mosquito bites, there is a small chance that you could have been exposed. And so some of the main symptoms that present with Zika virus are a fever with a rash, a headache, joint pain, like feeling really sore, your eyes are really red, or your muscles are really sore as well. So just overall body aches, a fever with a rash, headaches, or like red eyes. Your symptoms that you're talking about, nausea, vomiting, and fatigue, those symptoms don't really line up too much with what we would see in someone showing symptoms of Zika virus. However, that's not saying that you haven't been exposed, but it just makes me feel as a provider a little bit more comfortable knowing that you're not having any of these, hallmark signs of what we look for in Zika virus. So typically, the CDC, the Center for Disease Control, does not recommend routine testing for pregnant women that do not have the symptoms, the fever with the rash, headache, muscle and joint pain, and red eyes. However, if you're really concerned, we can test you, but it's also really important that we test your partner as well, because if your partner was bitten by an infected mosquito, his semen could have long-term effects for up to 6 weeks to 6 months. The Zika virus can live inside of semen. So if you guys are having unprotected sex and he has been exposed to the Zika virus, unprotected meaning no condoms, then he can expose you to the Zika virus via sexual transmission. So it's really important that until you're both tested and proven negative, that you, that you continue or you use condoms for protection, so that way he doesn't potentially expose you. It's really important that you know the effects of Zika virus and what it can have on your baby. So the main side effect it can have on your baby is a small head, which is what we call microcephaly. And it can also damage the nervous system, so your baby's brain and spinal cord, that those two things control all of the functions in your body. So it's really important that we keep an eye on your symptoms that you're having, that we get you tested, and that we just do an ultrasound for not preventative, but to just make sure that everything is looking okay. And that's really the plan that we do in this situation. Again, congratulations on being pregnant. I hope things go well, and I really hope you feel better. And that please follow up with me about getting tested and getting your partner tested. If you have any more questions, you can always reach out to me or come back to the office or call me. And I hope you feel better soon.